Swaddy Krap. I'm Dr. Fred Bloem here in Kensington, Maryland. I'm here with Mr. Tapley Holland, developer of the TruDOSE Regenerative Therapy, which I'm really excited about. We've been here together on day 2 now, treating patients in my office with some very challenging health conditions, and so I just want to introduce it to the Thai community as well. And so we'll have some translation, and I'll let Mr. Tapley Holland introduce himself.
Hello. Basically, what I created is a process and a testing platform using software to determine what is the right dose needed for you using your own blood. So a process as simple as taking a few drops of your blood to determine really what's kind of going on with you and what's wrong with you, to determine how much blood we need to pull from your arm, like a simple blood draw. And then we process in a centrifuge to really extract one thing, the platelets that are circulating in your bloodstream. Because we now know that the platelets are responsible for your body's entire immune system and your repair system. So if we can give you back the right dose and give it back to you, what happens is it goes around your body and starts fixing all the little unresolved problems that you've had over the course of your lifetime. It starts fixing those problems, and as it's fixing those problems, your symptoms start going away. And so we've treated some patients in the past 2 days with Lyme disease, Parkinson's, other types of neurological conditions. And people with emotional trauma. And you've seen some great results, yeah?
Yes, unexpectedly. Even while patients were in the office before they left, we observed some very interesting shifts. This patient with Parkinson's disease, that was amazing.
People don't realize that you have inflammation in the body, and inflammation is just simply the body's inability to heal these unresolved problems. And again, they're problems that you could have had since childhood, but we don't realize the impact that they do have as they stack on top of one another over the course of a lifetime. And now you have this disease condition or that disease condition. And so as quickly as getting the right dose back into you sometimes before you even leave the office, you have these shifts where in this case, he was talking considerably better. It wasn't as labored. His wife could tell it. She couldn't believe it. And it's emotional. It's just the sign of hope.
I'd like everyone to think differently about PRP. It's not just for blood clotting. It's not just because of the growth factors that we're interested. We know it can be injected to joints, hair restoration, there's aesthetic applications, but now we know just about any infectious disease, just about any neurologically degenerative condition, anti-aging, wellness. I just had a TruDOSE shot myself today.
Yeah, how do you feel?
I feel good.
Yeah.
I feel good. I generally feel good, but I like to be one step ahead. I like to prevent things. But yeah, I feel great. I guess patients or prospective patients might be asking, are there any downsides? What's the worst thing that could happen?
That's always a good question, and it's the answer is no. I think we're close to closing in on 17,000 patients. There's yet to be anything that's negatively been reported. It's your own blood. It's your own blood. The theoretical risk is virtually minimal to zero, and that's what we've seen and found. It's actually the opposite. There's nothing but upside. There's nothing but benefit. Depending on the disease condition, like when we work out and we start working out with our muscles, we get sore. This will create a similar effect for different disease conditions, and it'll make the body go through what's called a healing crisis, which is actually a good thing, because that signals that the body's actually working again. But that's the only, and many people recognize that as what's called a Herxheimer reaction, and so that's the only, I would say, negative benefit, but that's not even a negative. It's actually a sign that the body's actually doing a positive. So no, there's no down effects.